Hi everyone, welcome back to my channel. Today we'll be reviewing some eye anatomy and its related pathologies. So basically, what can go wrong with the eye? And we'll be using the first aid guide for the USMLE, which is the licensing exam for doctors in the United States. And we'll be doing this on my iPad with the Apple Pencil. Let's get started. First, let's orientate ourselves with this image. This is a cross-section of an eye, and in this image, the person is looking in this direction, and the light is entering the eye in this direction. And as you see here, and let's highlight these areas. You have the anterior segment of the eye. So that's the front part of the eye and the posterior segment. Now let's move on to some of the layers of the eye. And the first layer here, and I'll use a blue color for this one, is the sclera. And that's this outer layer over here. And it's the white, what we would call the white of the eye. It's the layer that you see that's white when you see a person's eye. And underneath that layer is, I'll use purple for this, is the middle layer, what we call the choroid layer, layer. And this layer is a black pigmented layer, meaning it's colored black, and that is in order to absorb the light entering the eye so that it doesn't reflect back into the eye and cause a confusing image. The next layer that we'll mention is the retina, the retinal layer, the inner layer of the eye. And this layer is where the phototransduction takes place. Phototransduction, which is the transferring of the light stimulus into a neural impulse. Now, this process of phototransduction happens through two types of cells that absorb light. And those are rods and cones. The rods and the cones. And they absorb the light and go through a constitutional change doing so, transfer this signaling through the optic nerve over here. This whole thing here is the optic nerve, and the main area where this takes place is an area that we call the fovea. The fovea. And that's this area over here where we want the image, the light entering the eye, to focus on. We want it to focus over here. Now, it's important to note that this area of the optic nerve, where it enters into the eye over here, is what we call a blind spot. A blind spot. And it's called that because no light that enters this area can be photo transduced. It cannot be converted into a neural impulse, since there are no rods and cones in this specific area. I should also mention that this optic nerve is the second cranial nerve. Number two, the optic nerve. And all of this that we've spoken about so far is at the back of the eye, located in the and around the vitreous chamber. The vitreous chamber. And this is the largest chamber of the eye, filled with a clear gel that helps the eye to keep its shape and to keep the retina propped up against the choroid against the sclera. It helps keep the shape of the eye and allows for light to enter to the back where the fovea and the retina are. Okay, very good. So far, we've covered the posterior segment of the eye. Now let's move on to the anterior, the front segment portion of the eye. And we'll see that the purpose of this portion of the eye is to allow in the light and focus it onto the fovea, which we spoke about. And the structure that does the focusing is the lens. And this works very similar to how lenses in glasses focus light. And this structure can change shape. It can become thinner or rounded based on where an object is located that we are focusing on. And we'll speak about this in a little bit. And the way it changes its shape to accommodate, that's what we call this accommodation, for distances of objects that you are focusing on, is done through a muscular layer called the ciliary body. The ciliary body. And these ciliary bodies are connected to, we call the zonular fibers. Zonular fibers. Very good. Okay. And when these muscles contract, they pull these. Here, let's make this a different color. Make this blue. Zonular fibers. Now, light enters the eye through the lens. But first, it needs to enter through this hole over here. And before that, through this protective layer over here. And this protective layer we call the cornea. The cornea. And this protective layer prevents various foreign bodies from entering into the eye. And what we call the pupil, is in fact a hole over here. This is the pupil. And it's a hole on the layer of the iris. The iris. Little layer. Oh, can't really see that. Let's change that to black. The iris. Now, the iris are these that you can see in this picture over here. And remember that when we look at the eyeball, pretend this is the eyeball, and this is the pupil. Let's make him have brown eyes. The color of the eye is the iris. And the iris are these muscular sort of curtains. You can call them curtains. And these will change shape depending on a number of stimuli, such as the brightness of a room or the distance of an object, to allow in more light or less light. They'll make the pupil, the hole over here, larger or smaller. And through this, they allow in the light to the lens, and the lens will focus the image on the fovea. Again, the fovea being the most sensitive area of the Great, we're doing great. And the last two areas of the eye I want to mention, which are both, again, anterior, frontal segment of the eye, are two chambers, the anterior and the posterior chambers. And as you can see here, the posterior chamber is this area that's behind the iris. It's behind the iris and in front of the lens, and the anterior is in front of the iris and behind the cornea. Behind the cornea. Okay. And these areas are important areas when we discuss a concept called intraocular pressure. Intraocular pressure. And this is the pressure that is inside the eye. And the reason that I mention this intraocular pressure in regards to the posterior and anterior chambers is due to the aqueous humor liquid that is released into the posterior chamber and drained from the anterior chamber over here. And we'll see that in certain pathologies like glaucoma, this causes a increased intraocular pressure. And can cause a number of issues here, which we will talk about soon. Okay, now before we move on to some pathologies related to the anatomy that we've learned, I want to first talk about a certain reflex. Let's make this easier to look at. And I want to talk about what's known as accommodation reflex. And this reflex is what the eye changes in order to accommodate an object moving closer to the eye. So let's put an eye over here. All right. And here's an object, a star. And let's say this object changed places and became closer. So there are 3 changes that occur in the eye to allow the eye to focus on this image and to focus the light to the fovea over here. these three changes are convergence, meiosis, and the third one is just known as accommodation. Convergence refers to the eyes moving towards each other. So that would be medially. And that allows the focus to focus on an image moving closer. And meiosis refers to the pupils. The pupils becoming smaller, which allows less light from surrounding areas to enter the eye, and thus allowing the pupils to focus the light on the object moving closer. Okay, and the third change in the eye that allows for the accommodation reflex is simply known as accommodation, and this refers to the lens of the eye. And if you recall, remember before we mentioned, here's the eye, the cornea, and there are these ciliary bodies connected to zonules, which connect to the lens over here. When these ciliary bodies contract, these zonules will actually relax. And when these zonules relax, the lens becomes rounded. And when the lens becomes rounded, it allows the light to focus on near objects, to focus that on the fovea.